Today we're going to be discussing the Clinical Decision Support Rule objective of Meaningful Use Stage 2. That's core objective 6. It's one of the extended items. They actually extended one of the objectives from Stage 1. The Stage 2 requirements, however, are quite a bit more demanding, and it has generated a fair number of questions on our help desk. So we wanted to generate some videos here to help everyone along and explain the details behind that measure. This first video is going to have just a summary to understand what it's asking for and how we're going to achieve that. We'll have some follow-up videos that give specific examples for the chart protocols or the health protocols that we'll talk about here in a second that show you how to specifically make those. So to look at the detail here, I've gone to provider registration. You'd go to application button, provider, and registration. That's one way to get there. Choose your provider. You'll come to meaningful use tab and then the stage 2 subtab. And here's core objective 6. That's what we're talking about today. Clinical Decision Support Rule. There's an A and a B to that objective. There's two different parts that they want you to meet. To get more detail, I'm going to click on more info on the right. That will show the official CMS documentation, and you can do this for any of the objectives. It's a great resource to understand the who's and the whys behind all the different objectives that Meaningful Use is asking you to pursue. So I'm going to click that now. Here's the official CMS documentation hosted out on our website. And you can see that there are two, Measure 1 and Measure 2, sections of this objective. The first measure is stating that you're going to have 5 clinical decision support interventions on and active for the entire reporting period. Those are going to translate to chart or health protocols inside of Practice Studio, and we'll briefly look at how that works in this video. We'll also have follow-up videos that go through the process of actually creating 5 sample measures. The second one is asking that you have drug-drug and drug allergy interaction checks enabled and implemented for the entire reporting period. By nature of using Practice Studio, that's already taken care of. So Measure 2 is very easy to meet in Practice Studio just by the nature of using our RX Writer and our full prescription capabilities. You do that already. As soon as you add a drug, it checks the drug-drug and drug allergy interactions for you automatically. There's no additional thing that you have to do to meet that. Measure 1 is the more demanding piece of it. And what it's stating is you have to have 5 of these support interventions on and active for the entire reporting period. They also ask that they be related to 4 or more clinical quality measures so that they're displayed at a point in patient care. If there are not clinical quality measures that are relevant to your scope of practice, you can choose your own topic, essentially, but it needs to be a high priority health condition. So let's kind of break that down and translate that a little bit, because that's one of the areas that's creating some questions. Okay, when they say that it needs to be related to 4 or more clinical quality measures, what they're talking about, we'll come back to Practice Studio. Here's our list of all the objectives for Stage 2 of Meaningful Use. If I scroll down here, we have all of our core objectives. We have our 4 menu sets for Stage 2, and then down at the bottom, starting with CMS 2, all the way to the bottom of this list, CMS 166, these are all the clinical quality measures. So what they're asking is you're going to create 5 chart protocols, and they want them to be related to something in this list that's pertinent to your scope of practice. Okay, they have also gone forward and said, we'll come back to the document, that they will not give additional guidance on specifically what to choose. You can see that right here. It's a little bullet point in their CMS documentation. That they have effectively said that we want you to use CMS measures if they're relevant. If not, it needs to be a high priority health condition. Beyond that, we're not going to give you additional guidance. They feel like it is best left to the eligible provider, that's what EP stands for, taking into account your workflow, patient populations, and the quality improvement efforts. So unfortunately, the specifics here are a bit vague, but we will help you through on how you would accomplish that and how you'd go and build these types of support measures. So let's take a look here at the CMS options. Effectively, you're going to look down through this list, find ones that you feel are pertinent, and then we're going to build some type of rule to notify you on a patient-by-patient basis to take some kind of action. Okay, and based on the lettering of the requirements, those can be fairly general, based, some of them even just purely based on age, to more and more complex. So age and gender and diagnosis, and so on and so forth. Okay, and Practice Studio has very deep functionality in that regard. It can go as general or as specific as you'd like in most cases. So once we've decided what we're going to test on. We'll say maybe we're going to test on breast cancer screening, which effectively, we'll again click more info. And here's our description of what this is. Women aged 40 to 69 who have had a mammogram. So an example of an interaction in this case, you'd want to notice if you see a woman aged 40 to 69 to remind you to advise them to go and pursue or go and schedule a mammogram. Okay. To do that, we're going to be using chart protocols. So we're going to come to P, Setup, Chart Setup, and then Chart Protocols. Okay, I'm going to go ahead and add just a real simple example one here. So we're going to add a chart protocol. In this case, it's going to be a breast screening. Let's say BRSC. Okay, so the options at the top here, a code and description just for your own use to find this protocol again in the future if you need to. When it is a hit for a patient, this will be the summary of it, and then the details right here. So remind patient to schedule their mammogram. The last important piece is that you set your execution type to automatic. What the automatic will do is automatically, whenever you come into charts for any patient, it will run this protocol against the patient and let you know if they're a hit. If you leave it at manual, you would have to specifically come here, pull up this protocol, and click run over on the left, which is not what the objective is asking you to do. So we'll go ahead and add a very simple criteria as well. We're going to test on the patient's gender. So I'm going to say add. There are lots of different types of things we can test on. We're going to pick gender. Okay, equal to, and we'll add our value, female. Okay, so you can see similarly, we could have tested on a diagnosis code, we could have tested on a financial class, charge codes, medications, all types of things, even lab values with specific numbers above and below. This is about as simple as you can get with a single gender relation, but again, you can make it as deep as you wish to. We'll click save. So now this is going to be a hit for anybody who's a female. We're also going to add a screening based on the age. So if we come back and look at that requirement, the age was 40 to 69 years. So we're going to add a screening age. We're going to screen it by age, and it's going to be between 40 years and 69 years. You can see there are options to have different months or years. We can choose to make this protocol recurring. In other words, once we dismiss it, it will reoccur 1 year later or 7 years later or whatever you feel is pertinent. In this case, we're not going to make it recurring, and we'll click save. So now, if the patient is between 40 and 69 years old and they're a female, they'll receive this protocol notice. We're going to click save, and let's actually see this work. We're going to go to medical records, pull up an example female patient. You can see they fall within that age range, and they are female. So we're going to go to start posting. And you can see down here at the bottom, we have a health protocol. The little red indicator shows that you have one. So we're going to look at that, and we have our mammogram reminder. So we can click, look at our details. There's the message we gave ourselves. We communicate that to the patient, and then you can either resolve or dismiss it so that it removes it from that list. And that's it. And that's an example of one simple protocol. We'll have some very short follow-up videos that show 4 additional ones beyond just that mammogram reminder. The key points to understand are that you do need to have 5 protocols. They may not be exactly the 5 we demonstrate here. This mammogram one and the 4 additional ones will be samples that are varying levels of complexity. If you have some different selections and don't understand how to create those in chart protocols after watching these videos, please do let us know it on our help desk, support.practicestudio.net. We'd be happy to go in there with you and help you get those set up. Thank you.